Good afternoon to all of you here at the School of Global Public Health and those of you on Zoom. Hello. So I'm Nancy Deneau, NYU's Senior Associate Vice Provost for Research. I'm really honored to be here with you today, and I'm standing in for Stacy Grossman Bloom, NYU's Chief Research Officer, Vice Chancellor, and Vice Provost for Research. She's so disappointed she can't be here with you today and sends her sincere regrets. Stacy, who's steadfast in her commitment and proud to serve as GPH's Provostia liaison, advocates for the strategic priorities set by your very own Dean Goodman, with input from all of you. I'm responsible for research operations and administration across NYU and its global campuses. I partner with GPH offices to provide a robust and reliable foundation of support for the amazing research being conducted and to assure our sponsors that we are proper stewards of the research funding that's entrusted to us. On a personal note, as Andrew so kindly mentioned, I am a graduate of GPH. It has a special place in my heart. I just graduated in May, and I'm also committed to doing my own small part in practice for public health as a volunteer EMT. So Stacy and I, as well as our teams, have the privilege of working closely with the school's leadership, Melody in particular, and the incredible faculty and researchers across the school in supporting GPH's existing programs and seeding interdisciplinary research across new ones. GPH inspires. The school is advancing public health and has positive impact on a global scale. GPH research teams are bringing their expertise to bear on solving public health challenges in over 40 countries across the world, and that's so prominently highlighted appropriately on your webpage. I want to take this moment to express appreciation for Melody's leadership and her "there's nothing we can't do" perspective. Stacy and I met Melody when she was GPH's Associate Dean for Research. And since 2019, we've had the honor of supporting Melody as she leads the GPH team in expanding its research portfolio. With Melody at the helm, GPH research expenditures have more than doubled in the past 5 years, which is an amazing accomplishment. The number of tenure and tenure track faculty who have won extramural funding for research has also nearly doubled. That is a very significant and incredible accomplishment given the funding landscape. As you know, NYU President Linda Mills has prioritized 4 strategic pathways that are key to NYU's mission: interdisciplinary collaboration, science and technology, global engagement, and flourishing. There's a place for research in all of those pillars. GPH is a significant contributor in advancing each of those objectives for the school and for NYU. First, interdisciplinary collaboration is at the core of what makes GPH special. The development of cross-cutting, cross-disciplinary degrees and partnerships across NYU schools and campuses reflects the school's commitment to breaking down traditional silos and tackling public health problems from a variety of perspectives and disciplines, so critically important and necessary to be competitive today. Science and tech and resulting innovations are transforming how we approach public health, and GPH is spearheading this change. With the MPH degree now carrying a STEM designation, GPH is positioning itself as a pioneer in integrating these critical fields into public health education. Second, global is not just part of GPH's name, it's embedded in your mission. The recent completion of the school's first global studies survey highlighted the extensive international partnerships and research efforts that define GPH, and I can attest to that personally since I run research administration and operations. You're all keeping us very busy, and we love it. Keep it coming. The school's ability to lead public health discussions, not only here in New York, but across continents, demonstrates the school's commitment to improving health outcomes worldwide. Finally, there's flourishing, an essential priority as we look to the future. Part of GPH's 5-year strategic plan is to become an employer of choice, creating a supportive and inclusive environment where every member of the community can thrive. So there's so much to look forward to, and there's an exciting number of years ahead for GPH. The school is positioned to lead the field of public health, not just through education and research, but also through the fulsome commitment to the well-being of individuals and communities everywhere. So I just want to thank you all for all of the incredible work, all of the incredible research that you're leading and collaborating on each and every day. Stacy and I and the entire team look forward to supporting all of you and your dean in everything you do and what we accomplish together in the years to come. And now, without further ado, I give you Dean Goodman.
I want to thank you all for being here today. And I also want to thank you all for the many contributions that you've given to GPH. I'm going to stand up here and brag, but most of the bragging is about all of the work that you all have been doing. NYU taught its first public health course in 1931 and offered its first Master's of Public Health degree in 1987. In 2011, the Global Institute of Public Health was founded, and in 2015, the NYU Board of Trustees approved the College of Global Public Health. In 2019, the Council on Education and Public Health accredited us as a school, and we changed our name to the School of Global Public Health. In 2021, which is our 5-year anniversary, we moved into our new home at 708 Broadway. Since 2019, we've had over 136 million in research awards. We ranked 23rd nationally for NIH-funded research. We have 28 centers, labs, and initiatives, and over 120 active research projects. Last year in 2023, US News and World Report ranked us in the top 20 of schools and programs of public health in the country. We have 17 academic programs, 7 academic departments and programs. We offer over 150 courses. We have 3 online MPH concentrations, 13 undergraduate co-majors, and 5 dual degrees. Our students come from 45 countries and 30 states. We have over 900 graduate students, and we engage with over 500 undergraduate students. 99% of our alumni are employed or seeking higher education upon graduation. We now have a network of over 2,500 alumni, and our alumni work in 42 countries around the world. GPH has several centers: our Center for Bioethics, our Center for Drug Use and HIV/HCV Research, the Center for Advancement and Dissemination of Intervention Optimization, the Center for Anti-Racism, Social Justice, and Public Health, the Center for Health Data Science, the Center for Public Health Disaster Science, the Global Center for Implementation Science, and the Global Mental Health and Stigma Program, along with the many labs that our faculty run. And these give our students a great chance to participate in great research that's happening all over the globe. A census as of May 2024, we had 57 union staff and administrative, 73 full-time faculty, that includes tenure track, clinical, and visiting faculty, 48 professional researchers, and 87 adjunct faculty. We have much to be proud of over this last year. Steve gave us a 7-year reaccreditation. We created the Department of Global and Environmental Health and appointed a chair for that department. As of the fall of 2024, all of our departments have chairs. This is the first time in GPH history where that is the case. We developed and we're starting to implement our strategic plan, including the inaugural GPH Culture Survey, and we saw that increase in our rankings. We started in May 2023 working to create our strategic plan as a community with a 2-day visioning summit that happened on the 3rd floor of our building. And there were lots of points for people to give feedback into this process, including some listening sessions and surveys and all the other annoying things that we asked you to respond to. Out of this work came an updated mission, vision, value statement, and we developed several goals in 4 key areas: practice, research, education, and organizational development. Our vision: as a school, we envision a world where all people experience health and well-being as a human right, rather than a geographic, economic, social, or political privilege. Our mission is to prepare public health professionals and communities to solve global public health challenges through cutting-edge research, transformative education, partnerships, and collaboration. Our values are equity, diversity, discovery, and collaboration. And what you often hear us talk about are our guiding principles as a school. We think big, we go far, we learn together, and we inspire change. We think big. We see challenges as opportunities. We conduct research that is responsive to the needs of our world, even if unpopular. We broaden intellectual boundaries through innovative inquiry and action. We go far. We work in partnership with communities around the world. We are committed to increasing local public health capacity and sustainability. Our research, education, practice, and service have no boundaries. We learn together. We value all lived experiences and our ability to learn from each other. And we inspire change. We challenge the status quo and unite towards an inclusive society where all voices are sought, heard, and valued. Our strategic plan ranges the 5 years, 2024 to 2029, and it outlines the priorities, goals, and strategies to advance global public health research, education, and practice that our school will work towards. This plan serves as an anchor for our work and our compass to guide where we're going in the future to make more equitable health outcomes a reality for all. But we're aware that world circumstances can quickly change, and so this plan is to be a living document that we will revisit and adjust to meet our internal goals as well as emerging public health needs. We have 4 goal areas. In education, our goals are to have our curriculum and programming prepare public health professionals with the skills and knowledge to affect change in diverse communities in which they work, that the student experience and our professional development opportunities support learners to excel throughout their academic journey, and that we evaluate our existing programs and create new offerings to meet the evolving needs of the public health workforce. For research, we want to conduct research to develop, implement, and evaluate real-world solutions that address the most pressing public health issues, both present and future. Our research addresses structural inequities and advances health equity. We want to expand our public health impact by growing our research enterprise, both domestically and globally. And we want to build research partnerships with community organizations and non-academic partners to ensure that our work is relevant, sustainable, and creates meaningful change in public health. In terms of practice, we want to provide public health practice experience that equips our students with the skills and competencies they need to be successful in their professional roles. And we want GPH to be known for preparing outstanding public health professionals and practitioners. In terms of our organizational development, we're striving so that our people, processes, and tools are aligned to achieve our vision and goals and enable sustainable growth. And we want to diversify and increase our funding sources. GPH has grown a lot over the last 9 years. When you think back about the fact that this was just an idea a few years ago, what has been accomplished is amazing. One of the places where we've grown a lot is the enrollment in our undergraduate co-major program, and this is a place where I think we can continue to grow. We would like to touch as many undergraduates on the NYU campus that we can, irrespective of their majors, and I think this is a real opportunity for us to touch more people, as we know the social determinants of health have impact, and irrespective of their careers, we'd like them to have just a little bit of public health training and a little bit of public health knowledge as they step out into the world. In terms of our master's enrollment, we're one of the fields where the pandemic helped. So we saw great interest in public health during the pandemic, had large increases in our student enrollment. Our student enrollment nearly doubled. We're starting to see a leveling off of our students. And I think for us, the right size is somewhere between 850 and 900 master students. We hope that that is a place where we can sustain in the future. In terms of our key performance indicators, our students to faculty ratio and our students for administrators ratio are fairly consistent. We saw some bumps during the pandemic, but it looks like we're getting back to pre-pandemic levels. You heard Nancy brag about the research. I won't spend too much time. I'll just say you must have had a great dean for research over these last few years. I will say that last year, GPHPI submitted over 150 proposals for the first time. And this has resulted in our direct and indirect research revenues growing substantially, with our indirect recovery exceeding $5 million for the first time in the school's history. Our tuition revenue has also grown 12 times in the last 10 years. And this is especially important because this is our major source of revenue. As you will see, in 9 years, GPH now has a revenue budget that's over $47 million, most of which comes from graduate and undergraduate tuition. And while that sounds like a lot of money, you will also see that GPH is expensive to run. We cost over $34 million to run, over 80% of which is faculty and staff salary and benefits. So the people are our most valuable, but also our most expensive asset. I just want to shout out a couple of highlights from different departments that I think are interesting and important. In terms of academic affairs, we introduced a new core course, so all of our students now take Introduction to Global Health. We think as a school of global public health, it's important that every student that gets a master's of public health has some training in global health, and so this new core course is designed to provide those competencies. This fall, we enrolled 423 master's students. That's a 14% increase over last year. We also worked hard to create a campaign to recruit more part-time students, students who are working and want to take their education part-time. And we hosted a fabulous Admitted Students Day in our new building, which was, I think, one of our greatest recruiting tools. We also had several of our staff members complete a DEI training course through Cornell on DEI best practices, and they have been charged with to come back with some recommendations for how DEI should be embedded in our school. We tried to make sure that we had people across all offices, and I think almost the entire student affairs team has participated in this training. I talked about a little bit about research. I just want to hit some key highlights. 84% of our faculty submitted a grant in the last fiscal year. 74% of our faculty are currently working on sponsored or extramurally funded research. We're doing work in 25 countries across the globe. What's super exciting is that our junior faculty are leading this charge. They're highly productive and highly successful in their work, and that's led to us having a strong NIH portfolio. And we have 20 community organizations and non-academic partners, 4 of which are global. In terms of faculty affairs, whether you like it or not, we rolled out the F-180 process. I know, we're working on it. We also implemented some early career workshops, and we're in the process of developing bright space for faculty and chairs, and the nerd in me loves the idea of us having a bright space where information and data are gonna be so that we can make strong decisions. I want to congratulate all of the faculty who were promoted this last academic year. This was several faculty for us, so congratulations to Dr. Cook, Dr. Armstrong, Dr. Tozen, Dr. Prepper, Dr. Abramson, and Dr. Shu on their promotions. And I don't know how many of you spend time on the 3rd floor, but if you ever find your floor boring, go down to the 3rd floor and just hang out. I have to give an amazing shout out to our student affairs team who makes that space so lively. They really have several initiatives focused on efficiency and student success. I think the one thing that we've all appreciate student affairs for is they decided that our theme this year would be careers and career development. And so the whole school is rallying around this theme of showing our students what careers in public health can look like. We're excited about the community engagement activities and also the activities dedicated specifically for our international students. We've had an increased number of events through student affairs. We've integrated NYU Connect. There's been lots of faculty involvement. The thing that I think is the coolest is the Oh So Amazing shop. If you haven't had a chance to see it, you should go down to the 3rd floor and check it out. It's a swag shop where students can purchase swag using bucks that they earn by attending different events and activities around GPH. I'd also like to talk about our increase in student clubs and programming. It's been great to see our students as a new school form so many clubs and have so much programming for our student body, and that's thanks to the support of our student affairs team. We have hired a director of alumni relations. We have enough alumni now to have a director of alumni relations. So welcome Sarah Gowrie, who's the director of alumni relations here at GPH. She has been working with our student affairs team and other teams to coordinate several events specifically geared to our alumni. We also have a new director of development. I think I saw Kathy here. Welcome Kathy, who joined us. In Kathy's short tenure, we received an anonymous donor gift that was focused on US and China relations. And that gift is designed to start the NYU Distinguished Lecture Series on US-China cooperation on climate health and to fund the Chancellor Yu Lingzong Student Exchange Fellowship. So you all know my fundraising priorities for this year are student scholarships, research innovation, and pathway programs. And so we're trying to find funding to support initiatives in those spaces. I really do have to thank everyone in this room. It takes a village for me to stand up here and get to brag about our school and say all the amazing things that happen. I want to give a special thank you to the Dean's Cabinet, Haley Blaley, who's the Senior Fellow of the Dean and also our Interim Vice Dean of Academic Affairs, Diana Silver, who's our Vice Dean of Faculty Affairs, welcome Simon Harley, who joined as our Associate Dean for Admissions and Enrollment, Andrea Maraca, who's our Associate Dean of Student Affairs, Donna Shelley, who's our Vice Dean for Research. Welcome to Andrew Berman, who is our Associate Dean of Communications, Promotion, and Public Affairs. And you all know Chris Tang, because he's the money man. He's our Vice Dean for Finance and Administration. You might not have liked him this year. You might like him a little bit more, just based on some things that have happened in the past few weeks. These people are working immensely hard so that I can stand up here and say all of the great things that GPH is working on and what we have accomplished. The last thing I'll talk about is we're turning 10 next year. I'm an October baby. I celebrate my birthday all month. I think GPH should celebrate our anniversary all year. And so we have a great planning committee focused on planning the activities for our 10th anniversary. I don't know about you guys, but when I was young, turning 10 was a big deal. It was the double digits, like your age was finally in the double digits. It was a really big deal. We all remember turning 10 years old. It was super exciting time. Just so that you know, that is my professional photo, also known as picture day at school. And those lasers in the background were all the rage in the 80s back then, so I'm aging myself. But we all remember turning 10, and we hope that you all as excited about our 10th anniversary that we are.
10 years feels like such a long time, but it really isn't. It all happened in such a blink of an eye.
As a student in 2014, I was part of global health, and there were only two other concentrations, community health and nutrition. If I think where we are now, we have 17 academic programs and 7 departments, so we grew a lot.
Everybody was just on one floor, all the way on 11th Street. The school grew when I finally started as a student. We were everywhere. We went from 715 to 716 to 726, 665, but now we're here in this one big building.
I remember when I first started working at NYU GPH, we were at 41 East and we were guests at NYU Silver Space. It's funny because at 708 Broadway, we are hosting NYU Silver on the 5th floor.
Our faculty has grown every year, and we now cover many areas of expertise with great strength. Our collaboration and consultation core is in its 2nd year. Our PhD program is in its 5th year. We have 10 students, and they are out and winning awards at conferences.
GPH has grown remarkably since I arrived 5 years ago, including an increase in the number of research centers. Growth happens through collaboration, and that's what excites me about GPH. GPH is a place that exemplifies the saying that the whole is greater than the sum of the parts. That's one of our strengths, and it makes it a great place to work.
It's been really exciting to be at a place where you can see changes happen really quickly, being on the ground and seeing something come from an idea to an actual implemented real thing.
I started working at GPH during COVID when everyone was remote and I had established all my relationships through Zoom. It was also a time when the school's finances were a little bit more precarious. Since then, we've grown tremendously to the point where we are at a much better place financially, and we've also grown not just in size, but also in our maturity as a school.
The culture here and the people here and the enthusiasm to get things done and get things going. And also to be invited into that process and being included and asked what are our ideas, what are things that we want to do, what are things that we want for our future.
Our Dean, Melody Goodman, a biostatistician, is a great visionary and a huge advocate of public health, and I'm very excited for the upcoming year.
So I hope you all are excited about this upcoming year as I am. We've definitely had our challenges and our growing pains as a school, but it's you all, the people, that make this a great place to work and the first job that I haven't wanted to quit. So thank you. I'll open it up to questions.
Okay, so you were given a QR code when you walked in. If you have questions, please submit through the QR code. Do I sound really weird? Okay, great. So submit through the QR code. I will get them, but we'll start with some of the ones that we already have. How will the GPH community be updated on the progress of the strategic plan?
So we're working on putting together a dashboard that'll make it a really clear data visualization so that everyone will be able to see our progress on the strategic plan, but we'll also be updating our community at faculty and staff meetings. The different goal teams will be presenting where they are and looking for feedback about where we could continue to go.
The next question is, how much bigger can GPH enrollment get? And is there a right size for our school?
Yeah, so I mean, to answer the first question is we can get as big as we want. The challenge is, what is the right size for our school? I think in terms of our master's program, we're kind of at the right size. Where I think we really need to grow is how much we're engaging undergraduates and how many undergraduates we're engaging, and also in our online program and offerings. And so I think sort of our master's programs are the right size, but there are places where we can grow and expand and still have some opportunity to grow. I was teaching when we increased a lot. I remember what that felt like as a faculty member. And so we're really cognizant of making sure that we grow in the right ways, that we're offering programs that are training students to be great public health professionals and citizens in our field of public health.
I'll ask this in two parts to make it easier. First, what are the school's key strategic priorities for the upcoming year?
I think one of the major priorities for us as a school is to get our processes, procedures, practices written down somewhere and codified and make sure that we all agree of the way that we want to do business. We grew really fast and we didn't really take time to think about how to do things at the larger size. And so I think we really have to go back and think about what are the best ways to do things. What we really did is just do double of the same. And that's not always the best way to grow something. And so I've asked each team to really go back and think through how do we make sure our policies, our practices fit the size that we are in a way that's appropriate for our school size and wasn't just taking what we were already doing and doing it more at a higher level, but are really thoughtful about the experience that we're giving students, what it's like to engage with the different offices, to make GPH a place where people know where to go when they're looking for a certain thing, and that when you get there, they actually help you. And so you'll go back to them the next time you need that thing. We were a young school, and so we were really nimble and flexible, and that's really important. But I think as we've grown, we really need some more structure and policies in place, and that's also to ensure equity, to make sure that the resources we have are equitably distributed.
The second part to the question, how do you envision faculty, staff, and students contributing to achieving these goals?
I hope people point out when things are not working. I know sometimes we have a culture where things don't work and people just complain about it in their small circles, but I hope you elevate when things are not working and see that when people bring those issues to us, we're working hard to try to address them and figure them out. And that we're also open to your solutions. Like, you guys who are in the field or doing the thing day to day have the best knowledge about how things should be done. We want that knowledge and expertise, and we want to put things in place that make people's jobs easier, more efficient, more joyful, but provide good experiences to our students and the rest of our community.
The next question is, how can alumni contribute to the strategic plan?
There's lots of ways for alumni to contribute. One way is to be your fabulous self and have the amazing career so we can brag about all the great things that our alumni go off to do. Another way that our alumni often get engaged is to be preceptors for our students to do their practice experiences. And so if you're in a place or space where there's an opportunity to take on interns, it's often great for our current students to work with an alumni as their preceptor, because they know that person really understands what they're being asked to do, what the challenges are, and can really give them real world advice about the fields that they're maybe interested in.
Is our building full? Will we grow to the point that we will use the whole building?
Technically, we are currently using the whole building. Our building is full probably mostly on Wednesdays when most people are in. When everyone is in, our building is technically full. Amanda can correct me if I'm wrong, but our building is technically full. I think it doesn't always feel full because of our hybrid work environment.
When you meet other public health school deans, how do you portray GPH as unique or different than others?
I talk about how great it is to work here, that I've worked in other places doing public health and didn't have this experience. And the thing that makes us different is our people. It takes a unique group of people to come and say, we're going to start a school of public health in a city that already had 2 schools of public health, right? So it takes a bunch of, I call us scrappy, I use that in a good way. Like, it takes a bunch of scrappy New Yorkers to say, we can create something new, we can build something different, we can do something innovative. And to have a bunch of people that kind of have that spirit is why I think GPH is the way it is. To have students who will say, I will start a student club at my school that I'm going to be at for 2 years. To have those types of people is what makes GPH great. And I brag about us. I brag about our diversity, our commitment to education. There's a lot of things that we do that other schools say they do, but we actually do them.
How will the school be kept up to date on the ongoing dean search?
That's not really my job, but I will say that our leadership is planning to do the dean search next year. I have signed a contract as interim dean that goes through August of 2026. So you guys are stuck with me for the next year and change. And then whoever is chair of said search committee will have to give updates as appropriate to the community about what transpires. I'm absolutely sure I will know nothing about that for conflict of interest reasons.
How can students be more involved in research projects?
I think students here are really lucky that most of our faculty have labs that are primarily student staffed. And particularly our master's students get a chance to really be involved in research in ways that I don't think happens at a lot of other schools that have a larger doctoral program and many more postdocs. Because our doctoral program is fairly small and we have a small postdoc program, there's lots more opportunity for our master's students and our undergraduate students to get involved in research. I always tell them to visit our centers, labs, and initiatives page. I believe our Vice Dean for Research is on top of keeping it up to date because it was a little bit outdated. But there you should be able to see all the active research labs that are going on and contact people that you're interested in the work they're doing. Start with a compliment, that never hurts. Tell them how great their research is and you'd love to be a part of it.
All right. In the interest of time, this will be the last question. There are more questions that were submitted. These will be answered via email in about the next 2 weeks. So the last question is, how can staff and faculty be involved in celebrating the 10-year anniversary?
I will also point you to Jose Pagan and Matthew Liao, who are the chairs of our 10th anniversary planning committee. My understanding is that they have a plan and then they will be asking lots of people to help implement said plan. So stay tuned. You know, we always are asking for help. So there's plenty of opportunity for people to get involved in the 10th anniversary planning. Thank you all for coming. Sometimes you plan something, you don't know if people are going to show up. So it's so great to see you here in person, those online. And please do grab lunch and we will be here afterwards to answer any additional questions.